The biggest drawback of modern medicine is that we have started treating the human body like parts in a machine. We started to treat humans like fixing a car, just focusing on the broken, isolated body part. But this is why most of the chronic conditions never actually get better. As a physician board certified in family medicine, sports medicine, and integrative medicine, my clinical lens is completely different. At Lexington Integrative Sports Medicine Clinic, we view your health through a framework inspired by nature, and that is the whole tree. Even if you're present with a broken branch, like uncontrolled diabetes, chronic musculoskeletal pain, fatigue, or depression, we evaluate the entire system. So we start by addressing your soil, and this represents your daily foundational habits, your sleep, your nutrition, your mindset, your stress levels, and your environmental inputs. It doesn't matter if you're managing diabetes or recovering from an injury or navigating burnout, the soil comes first. Before we can expect your body to repair or perform, the soil must be biochemically capable of true healing. And because everyone is unique, we never force you into generic guidelines. We meet you exactly where you are. So the next comes the root, which dictates your inner resilience and deeper cellular biology. So this is how your cells produce energy and how your nervous system responds to stress. So Eastern medicine calls this yuanqi, the innate life force. Yes, this sounds a little bit woohoo, but hear me out. I'm a strict evidence-based physician, except that I just keep my cup open to mechanisms that work. We all inherit a unique genetic baseline, which is why health risk varies so widely. For example, one might develop diabetes while being only slightly overweight, while another body tolerates it without any issue. One person can train relentlessly and stay injury-free, while another is highly prone to strain. Our goal is to optimize your cellular battery by dampening systemic inflammation. So when clinically appropriate, we discuss about purposeful supplementation, medical acupuncture in this layer as targeted biological triggers. So the next layer is the trunk, your body's internal healing pathways. So this is the structural highway of nerves, blood vessels, and fascial planes that coordinates your daily circulation and metabolism. So for many, fixing the soil and addressing the root is far enough to, let's say for example, stabilize one's blood sugar or maybe help resolve the pain. But let us say, if a chronic issue, let's say for example plantar fasciitis, persists, the trunk is where we intervene. Here we utilize targeted rehabilitation and sometimes medical acupuncture to reset the nerve pathways or specific structural supplementation to reopen those pathways. And finally, we reach the branch. And these are the acute injuries or the localized structural problems that the world actually sees. A sudden sports injury, an arthritic flare-up, or a sudden spike in blood sugar. And this is where Western medicine shines. And we do not shy away from it. When clinically appropriate, we use the lowest effective dose of pharmaceuticals, or let's say for example in case of a sports injury, we might talk about regenerative medicine options like platelet-rich plasma, prolotherapy, medical acupuncture, and sometimes even cortisone injections to manage the acute fire. And if an injury requires surgery, we connect you with the right surgeon. But at the same time, again, we're trying to focus on optimizing your soil, your root and trunk so that the branch can heal long term. So we never stop at diagnosing a symptom and handing you a prescription. We move fluidly across the entire layer of the tree to optimize your health. And if you're interested to know more about our clinical practice, make sure that you will check out the link in the description box below. And for general patient education, focusing on sports medicine, focusing on complex primary care issues, make sure that you follow this channel. And if you want to know more about my journey into integrative medicine, then check out this video here, and I'll see you in the next video. Until then, goodbye.